Hello, I am Tionne Stubblefield, and I will be speaking about this therapy. Before I jump into it, I would like to take a second to thank Dr. Grafton and Dr. Buby for their advice on this project. Boron neutron capture therapy is a non-invasive treatment for tumors or cancers found in the central nervous system, which consists of the brain, neck, and spinal cord. Tonight, first we'll discuss some background and why boron. Secondly, an overview of how the treatment works. Next, I'll tell you about the current boron agents. Then I'll transition into my proposed boron agent and why I believe it has potential as a candidate. Finally, we'll end with a brief overview of how I would test my proposed boron agent. Tumors or cancers found in this region of the body have a very low survival rate. Less than 36% of people survive 5 years after diagnosis. This region of the body controls many essential to life functions like breathing, so performing surgery can be extremely risky. These are just a few reasons why this treatment is so important. So, how did boron get picked? Boron is an ideal element for many reasons. Boron compounds are typically low in toxicity. The uptake of boron is higher in tumor tissue than in normal tissue. And boron sticks around long enough to be effective, but then after the treatment, it rapidly clears from the system. A major advantage of this therapy is that it allows the focusing capabilities of chemotherapy with the localization ability of traditional radiation therapy. Essentially, that means it allows a great amount of intensity to a specific location in the body, which sounds like the best of both worlds. So why does this treatment need improvement? Due to the way that the neutrons are delivered in current boron agents, superficial tumors are the only ones that have the ability to be treated. With more improvement, then this treatment could apply to more tumors and more areas outside of the central nervous system. This opens the door to this treatment being done as often as chemotherapy, radiation, or surgery. As an overview, the treatment works by first having diagnosis of the tumor, typically by a PET scan. Then administration of the boron agent. Next, image the tumor again to ensure that the boron agent has been taken up, bombarded with neutrons, and finally, that produces the lysis and killing of cancer cells. Now in more detail, here we can see that the treatment starts with the neutron bombardment of a boron atom, which forms boron 11. This isotope of boron will undergo a splitting process called fission to produce two byproducts. The intended product is the leftover gamma radiation, and this has the cancer-fighting properties. The section labeled B is what it would look like on a cellular level, with the blue cell having boron in it because it's a cancer cell. Remember, I said that this is non-invasive, so C shows what it would look like on a macroscopic scale, similar to getting an X-ray done, but with neutrons. Lastly, D shows that the neutron beam is focused on the cancer cells. These are the compounds that have shown the most promise in terms of success in the clinical setting. The compound on the left is BSH, which has a significant amount of boron in comparison to the compound on the right. As the name suggests, BPA is a boronated amino acid, specifically phenylalanine, which is nonpolar. The fact that it is nonpolar will become more relevant in a second. The problem with BSH is due to its small size and hydrophilic nature, it does not pass the blood-brain barrier intact. On the other hand, BPA has an extremely low amount of boron, which requires a much higher dosage to be administered. Both have a wide variability in the amount uptaken by tumors, thus producing inconsistent results. Now let's talk about the blood-brain barrier. The blood-brain barrier is typically imagined as a physical barrier, like a fence, used to regulate what comes in and out, but rather should be thought of as a ninja delivery man, who is super great at his job and only delivers essential things while filtering out anything harmful. The packages that can be delivered are typically small and fat soluble, which also means nonpolar. Nonpolar means that there's an even distribution of the electronegative groups or an absence of them altogether. Those electronegative groups are the ones that hog electrons and are found on the periodic table close by fluorine. Keep the chart in the upper left corner in the back of your mind as I begin to tell you about my proposed boron agent. The basis is a modified quinone, which typically comes without any of the substituent groups I have labeled as A and B. There are two of each. This specific molecule, AZQ, is lipophilic, which means it readily passes through the blood-brain barrier. This molecule also shows anti-tumor properties already, but you might be thinking, where is the boron on this molecule? I thought that was the whole point. It is. I believe a synthesis reaction could be done to attach boron to AZQ. Due to the nature of the molecule, it reacts with electron pair groups easily, and lucky for me, many boron compounds are exactly that. The synthesis will not be as easy as gluing boron on and will take some modifications to allow for this. The success of this new molecule as a boron agent could be tested in mice trials. This would require regulated administration of the boron agent at varying amounts. The effectiveness could be tested with a PET scan, and success would be shown by a significant reduction in the size of the brain tumor. These results should be compared to results with BSH and BPA. As a recap, before we look at a comparison of the agents, remember that AZQ is a molecule that has two of each substituent groups. So regardless of where the boron attaches, whether to group A or B, it could attach twice, putting the total amount of boron above BPA but lower than BSH. The molecule has the ability to pass through the blood-brain barrier because it's nonpolar. The administration of the new agent is technically undetermined until trials begin, but since the molecule is nonpolar, it has the potential to struggle with administration. The drugs are typically administered intravenously, which is done with a hydrophilic drug. Lastly, the effectiveness and reliability of this new drug would require actual trials to determine. Looking into the future, there is more room for development. There is an inherent contradiction for what the molecule needs to be to work for this. It needs to be non-water soluble to pass through the blood-brain barrier, yet that directly impairs its ability to be administered. Moreover, there needs to be a bit more fine-tuning in terms of how the synthesis will actually play out. Overall, I hope you have learned a little bit about the significance of continually improving research in current treatments. My proposed boron agent of combining an already lipophilic molecule that fights tumors with boron could be beneficial to this treatment. This treatment has endless possibilities, like treating cancers outside of the central nervous system, that will become open if more improvements are made. Thank you so much for listening.